good evening. Hope you're all well, my friends. This is Ray Collazo, and you're watching and listening to the Found in Translation Talk Show. The talk show that stacks truth about politics and today's hottest issues. Thank you so much for joining us. Again, nothing but warm feelings and love go out to all of our family and friends as we cope as best we can and support each other during the COVID-19 season. And today's episode is dedicated to many people, but ultimately dedicated to the mental and spiritual health of the Found in Translation community. Again, this is Joe Straight Collazo. Thank you so much for joining us. We know there's a lot you could be doing on Thursday night. Not that you have sports to watch. I guess maybe you don't have as much to do. But we appreciate you taking the time to watch us either live on Facebook, Twitter, or YouTube Live, or as a podcast on Ride or Dies. You can download and subscribe anywhere you can download Found in Translation podcasts, or listen to the program at WPPMLP 106.5 FM radio in Philadelphia, hashtag People Power Media. Let's just go right to this conversation. We have some incredible guests that are going to support us again to really ground us in our health, our mental and spiritual health during this very trying time. Say hello to our co-host, running it back again, Sulaih Picorelli. How are you, Sulaih?
How are you, Ray? I'm doing pretty well. Doing really good. Good.
No, we're going to have a great conversation. And, I don't want to put my special guest on this, very special guest on the spot, but I do have to share this because I got to keep it real with the Found Translation community.
Mm-hmm.
Well after our very special guest, who you're going to have the honor of introducing in a moment, who's really our mental health specialist here on Found Translation, was booked. I had a bit of a breakdown myself yesterday.
Yeah.
I woke up to some pains, fainted, and ended up in the hospital most of yesterday. And
wow.
And fortunately, all the medical people, and I must give a lot of love to the people that took care of me, said there's nothing wrong with this guy. Nothing wrong with his heart. No viral infections. No pneumonia. Nothing. They kept checking, double checking, MRIs, CAT scans. So they said, well, as best we could tell, this was some level of a anxiety attack.
Mm-hmm.
And so, it's a painful lesson, but a blessing nevertheless, because it grounds us in the fact that we have to keep ourselves in health in every way. And that's really the theme of today's conversation.
How are you feeling today?
I feel a lot better. I'm tired, but I don't have the pain that I had. Mm-hmm. But I definitely got to get some rest the next few days. Sulaih, let's, on that light note, because I have to keep it real with people, so my point is we're all going through it on some level. Even people that are happy talky on podcasts. Sulaih, with that note, let's introduce the show, introduce our very special guest, because she has a lot to share with our Found in Translation community.
Absolutely. Yes, we are very lucky to have Dr. Miguelina German, the Director of Pediatric Behavioral Health Services at Montefiore Medical Center. Welcome, Dr. German, to the show. Thank you so much for joining us this evening.
Dr. German, you're such a... Yes. Talk to me.
No, I was going to say, I'm really impressed that you pushed through and you came and did your show less than 24 hours after being in the hospital and going through all those tests. I think that's pretty amazing. What a commitment you have to your audience.
Well, I'll say this, is that this is a happy place for me. So, this isn't work in that sense. Other things I put to the side pretty easily, to be honest. But this is important because if I'm going through it, and I'm very privileged in so many ways during this crisis. I know that people going through it, so we have to start this conversation. Dr. German, Sulaih, repeat that title that Dr. German has again, just so we can ground people who we're talking to here.
Sure. The Director of Pediatric Behavioral Health Services at Montefiore Medical Center.
Okay, so first of all, this episode is also it's called New Yorkers and our New York first responders. So Dr. German's a friend of ours and an advocate on many levels. Dr. German, let's just start with how you're doing. I mean, you're on the front lines as a medical professional, approaching and servicing this area in a distinct manner with your mental health acumen. So just start with, as a mental health professional, servicing New Yorkers right now, and as a New Yorker yourself, a proud New Yorker, how are you feeling? And give us a sense of what it's like on the ground for you day at Montefiore Center.
Well, I can share with everyone that working in a major medical center in a hospital is reflective of pretty much everything you've been reading in the newspapers and watching on the television shows. It's very, very intense. Everybody is working incredibly hard to try to meet the demand that this pandemic has brought on us. We want to try to save as many lives as possible. And we know that in order to do that, we have to create more inpatient units, more beds, get the equipment. But then we also have to ask our doctors, our nurses, our community health workers, our social workers, our psychologists, so many of us who do not typically work on the inpatient side, are being asked to serve, are being asked to do work that we don't typically do on a day-to-day. And as you can imagine, that is very, very stressful. And so I think in terms of the mental health toll, the emotional toll that this pandemic is taking, I'm happy to speak with your audience and with you about what it's like in a hospital setting, in terms of just the pressure and the strain and the toll that can take, but also what is it like for everyone else living at home in New York City. You know, our apartments aren't that large. We don't typically live in big houses with yards. And so, you know, what is that like for people day to day going through this pandemic?
You know, Dr. German, you in our prep before the show, right before the show, you talked about how you framed this moment we're going through. Can you share with your audience how you're framing this this COVID-19 season, and that'll help all of us sort of ground us what we're really facing here?
From a mental health perspective, I view the COVID pandemic as a mass trauma. I believe that is because trauma is when you fear that your safety is threatened. You might actually fear for your life. You fear for your livelihood in a way that it could have such a devastating impact on your ability to live your life the way you've always lived it. So there's just this constant threat or threats that most of us are living under to a lesser or, greater degree. And when we go through something traumatic, something threatening, typically it lasts for a short amount of time. And so your body gets activated because your body senses danger. So, you've probably heard of like the fight or flight mechanism. Sometimes people also say people can freeze. And these are biological mechanisms that we have to help protect us and help keep us safe when we're in danger. I think the challenge with this particular threat is that it is going to last for a long time. It is not a day. It is not a week. We're already a month in. Reports, according to the news, aren't clear on when it's going to end, but I think everybody feels that it's not going to end tomorrow. And so that fight or flight or freeze mechanism that we all have naturally, it's not turning off. It's staying on day after day, week after week. And that is almost like you're driving a car and you're not stopping to rest, right? So what's going to happen if you drive a car on a highway? You're going 60, 70 miles an hour and you don't stop for gas, you don't take a break. The engine is going to burn out. And so that's a little bit of what's happening to us biologically in terms of our stress response. And so when I describe it as a mass trauma, it's because to a greater or lesser degree, everybody is feeling some kind of threat. And there's also a lot of loss. So you might not be working. Your children may be participating in school, but I have a dear friend in Florida who posted on Facebook that her daughter's senior graduation is canceled.
Yeah.
You know, something that she's been looking forward to all year and all throughout high school. So there's a lot of loss that's happening with this pandemic. And so I think if we can all start to think about it as a mass trauma that we're all experiencing together, then we can understand when our chest is tight and we're having trouble breathing, and maybe we get hot or cold and your heart is palpitating like crazy, and maybe you faint, like what happened to you yesterday, Rafa.
Yeah.
You can at least hold in your mind, I wonder if I'm having a panic attack, right? It could be a heart attack, and you don't want to make assumptions, of course, but at least you have that in your mind, you know, like, oh, wow, I'm experiencing a mass trauma. One of the responses to mass trauma is this constant anxiety, just constant. And I think that can just potentially help people understand what might be happening to their body, what they might be feeling and experiencing, because we all experience anxiety in different ways.
Hey, listen to Dr. I'm sorry.
No, please.
Yeah, you listen to Dr. German breaking it down. How do we support what are the tenets of the principles of mental health that we have to understand as we tackle the COVID-19 season? I'm going to allow Sulaih Picorelli to jump in this conversation. She's got a question. We also have a local Latina elected official on the line that wants to ask you a question, Dr. German, Janet Diaz, so from Lancaster, Pennsylvania. Please, Janet, stay on the line. You're going to be on in a second. But to that point, before I get to Sulaih, you know, it's so interesting, Lena, that you talk about how this is a different type of trauma, because New Yorkers, thinking about Caribbean people too, like, we've gone through these traumatic experiences, whether it's 9/11, the earthquake, the hurricanes, and other natural disasters that our community goes through. I remember when that plane crashed, that JetBlue plane crash that was going to DR. What a big impact on all New Yorkers, particularly the Dominican community. But those are like one hits. Those are like you know, like pot shots. You know, like, and you have a minute to kind of get yourself together. This is a long slog. Sulaih, jump in this conversation.
Well, and Dr. German, you know, she touched on some of these, you know, feelings that you start to get and to identify, you know, when you're about to have a sort of, you know, seizure attack or panic attack. So this is definitely really helpful. Any recommendations for, or I don't know, well, can I say that recommendation for?
Sure. Tips or techniques.
Yeah, right. So for like the sleep pattern is just all out of, you know, just out of whack. Like people just can't sleep like we once did, you know.
Right.
It's just this really awful feeling that I have to sometimes set aside myself of what is the worst that could happen. And well, you know, what for, you know, like this feeling of what for, and that's really awful.
Yeah, so I agree that probably most of us are having trouble sleeping. I can share with you that on some nights I'm having trouble sleeping. And so one of the things that I have found helpful is different apps that are pretty easy to download on your phone. So I'm not endorsing any particular app, but I use Calm. And they have something called Sleep Stories. They have something called different kinds of soothing music that I listen to when I wake up in the middle of the night and I have a lot of trouble falling back asleep, or I just have trouble falling asleep. And so what I want to share with your audience is that if you're having a lot of anxiety, if you're having a lot of distress, number one, I think that's pretty normal. It's a pretty normal response. And maybe people in the audience are wondering, like, when should I be worried, right? Dr. German is describing this as a mass trauma. A normal response to trauma is anxiety, right? So I think it's pretty normal right now, or typical, that a lot of us are experiencing a heightened sense of anxiety. But how do you know when you need to maybe get extra help? And what I want to share is, are you having trouble kind of doing your activities of daily living? So what does that mean? Are you eating? Are you able to shower? If you have children, are you able to feed them? Are you able to, pay your bills, assuming you have enough income to do so, right? So those kind of activities of daily living that keep you functioning, if you start to have trouble doing those, then I would encourage you to reach out for help.
Dr. German, I'm sorry.
And you
Keep
just
going.
want some tips or techniques on what to do. I think Rafael hopefully will share a short video that a coworker of mine named Dr. Dana Crawford and I made called Anxiety and COVID-19. And we actually made it in English and in Spanish. And, we're happy to make that available for your audience. It talks really specifically about 2 different types of things we all have to do to get through this pandemic together. One is you have to maintain your emotional well-being. And the second is you have to have skills to get through the moment. So I'll give you an example. I have a 5-year-old, 5.5. She gets very upset with me if I don't say the half. And I have a tip out there for all parents during the COVID pandemic. My tip is you need to lower your standards. Mm-hmm. So what do I mean by that? What I mean is
my kids are going to love that tip.
Right? The expectations that you have of your children and you have of yourself as a parent, when you're allowed to go outside and your kids are allowed to go to school and you're allowed to go to work every day, you have to relax those standards a little bit if you're really struggling in the moment. So what does that look like? Well, the other day I had to pick up my daughter and I had to get back to the house really quickly because I had a work call. She really wanted to go to the park and I didn't have time to take her. And she was going to throw the biggest tantrum. And I just did not have the energy or the time to wrestle with her. So what did I do? I let her, let's say I let her eat candy for breakfast, right? Like something that I wouldn't typically allow my child to do, right? Like eating chocolate for breakfast. But in this moment, right? In this moment where I really just had to get through the moment without making it worse, that is what we call a distress tolerance skill, right? Like how do you just get through this moment because you have to move on? And I think we're all probably having moments like that as parents. And I'm here to tell you, don't feel guilty. Put that parental guilt to the side during this pandemic. This will not last forever. I promise, right? We will get back to normal, our new normal eventually. And then you can go back to saying to your child, no, we don't eat candy for breakfast. That's not what we do. That's not really healthy. But
that's going to be funny to go back to that.
Right?
Yeah, right.
But during a pandemic, cut yourself some slack.
Dr. German, we have Janet Diaz on the line. Janet is actually Councilwoman Diaz, City Councilwoman in Lancaster, Pennsylvania, and also a candidate for Pennsylvania State Senate.
I don't think I hear him.
Can you hear me, Councilwoman? Sulaih, say something. Maybe she hears you.
Councilwoman, can you hear us?
I can hear you, but I can't hear him.
All right, we'll just have her ask her question. It's okay. She doesn't need to hear me.
Janet, so if the line is yours, you can ask Dr. Herman your question.
Okay. Can you hear me well?
We can hear you, yes.
So I saw someone post that 34% being affected versus percent of African American, and I think 13% were of Anglo descent. Can you give me an insight exactly how they came about that number? Was it something that they just pull out of their hats because of data that they found?
I'm sorry, your question cut off, so I didn't hear the first part of it.
Okay, I saw that someone had put out data about 34% Latinos are being affected by COVID-19 versus other races. Like the African American were at 28%. The Anglos, I think, if I'm not mistaken, they were at 18%. 10% were
Yes.
8%. So I was wondering, how did they come up with that data?
Okay.
And that's New York City specific, I believe, Dr. Hinman. That was New York City
Yes.
specific, I believe.
Yes. So
Yes.
what I can share with you is that there is data that's confirmed in New York City about differing death rates. So Latinos, we are dying at a much higher rate of COVID-19 compared to other ethnic groups. I believe the first group with the highest death rate is Latinos. The second is African American. This is a huge concern for us at Montefiore Medical Center. We are located in the Bronx. Most and many of our patients are minorities, are Latino, are and different other immigrant groups. And so what our doctors are hypothesizing is that it is different social determinants of health. Things like housing insecurity, food insecurity, loss of income during this pandemic that are exacerbating the health disparities that we are seeing now. And so Montefiore is very concerned about these statistics that really just came out yesterday. They were confirmed yesterday. And we are putting together, a task force to address this as quickly as possible in real time, because really these numbers are not acceptable. And so they are correct. These numbers are accurate, and they are incredibly concerning to all of us at Montefiore.
Councilwoman, can you hear me now? Sulaih, can you ask her if she has another question?
I can hear you now. Can you hear
okay.
me?
Do you have another question, Janet?
I had one more question.
Okay.
In reference to those that may have expired, how many children have you seen affected?
So I don't have numbers for you specifically, but obviously most people have a family, most people have loved ones. And what Montefiore has done, and we're very proud of this, is we have reassigned clinical psychologists, other physicians, social workers to work the palliative care unit. So we have an incredible doctor called Dr. Sarah Norris, who's the director of our Children's Hospital Palliative Care Unit. And so what we have is, because you're not able to visit your loved one when they're ill at the hospital, right? There's no visitors allowed right now. And it is not the way anyone wishes their loved one would experience such a devastating illness, right? To be alone without their loved ones. So what we've done is we've assigned every family a physician, and they call the family regularly. It's called supportive callers, to give them updates on their loved one. And if the time comes that the patient dies, it is that physician who makes, the death notification, and then we immediately offer grief counseling to those families. Everything has to be done over the phone, but we're working as hard as possible to support these families who are not only losing a loved family member, but losing them in a way that if this wasn't a pandemic, it wouldn't be happening like this. You know, you'd be there at their side. You'd be able to visit them. So we are trying to adapt to this trauma, because that really is another example of what I mean by a mass trauma. We're trying to adapt to this mass trauma for our patients and our patients' families as quickly as possible.
Dr. German, give us another tip to support our children through this process. You know, there's obviously lots of variables in different households, whether it's space for people to have their own space. Some families are dealing with some extreme economic challenges at the same time. But our children, you know, they're all dealing with this on different levels, right? So give us a tip and some advice for people to, how do we support our children's mental health during this process?
Absolutely. Well, I will say this, a parent with good mental health is going to predict a child with good mental health. So parents, you need to take care of yourselves. All right. But I think for younger children in particular, they are going to understand what you tell them. So do not tell them more than they need to know or understand. Mm-hmm. Do not overshare. Do not have the news on all the time, because they will pick up on your anxiety and your tension. So, you know, you need to put cartoons on. You need to watch funny shows. You need to do fun activities to change the energy in your home. Okay. So, of course, things like routine, right? Trying to get up more or less at the same time, trying to eat breakfast, trying to do a little bit of work, right? If they're doing remote learning, it doesn't mean like everything has to happen by 8:30 or 8:45, but just kind of having that routine that is very soothing to children. And they may not be grateful, right? You may be like, it's time to take a bath. And they're like, come on, Dad, I don't want to take a bath today.
I don't got school tomorrow. The teachers aren't there. I mean,
right.
I'll do it when I do it. It's on the computer. Yeah,
exactly, right?
But
if you insist on that routine, it is comforting to them, whether they're conscious of that or not. So I think that's really important. And then I think if your child is showing anxiety, you know, there's resources that I can share with you. But a lot of the tips that we have for adults, so, you know, kind of listening to soothing music or trying to distract yourself, things that work for adults can also be adapted for children. But again, I always say healthy parent, healthy child.
No question about it.
Parents, you need to take care of yourselves, because when your children are scared, they come to you.
That's right.
Right. And so if you're scared and out of control with anxiety, they're not going to get comforted by you. They're just going to pick up on your energy.
Well, that became full circle for me yesterday, because part of the anxiety that I've been feeling has been, you know, this idea that, you know, I want to protect them from getting sick. Right. Even besides, you know, the political side of me, I'm upset. That's another level of it. Right. But I just want to protect them from being sick. So I'm like, I don't go out. I got the gloves on to go pick up the mail, the whole thing. And then this happens to me. Right. And then seeing the look, the worst part of yesterday was, I mean, look, I was scared on some level. Right. Anytime there's a chest pain. But the worst part of yesterday was my oldest son, who's 10, who has ADD. And you and I have spoken about those issues and chat. You've helped us on a personal level with that process. But was that he saw me fall. He was the only one that physically saw me faint, and that freaked him out, obviously, right? So I'm in this the anxiety of me wanting to protect them, I had made him go through that. So it's a lesson for me, right? So these are all lessons for us. Lena, how do we help each other, I guess is my question. You know, we got people live with each other, we got relatives, we have people that we know we're going through it, whether we're living with them or at distant. How do we help each other as colleagues, as relatives, as friends cope with this time period?
Let me tell you what helps with trauma. What helps with trauma is social support. And I'll give you a concrete example. A dear friend of ours, Rafael, Jennifer Duran, went food shopping for my family yesterday. And it was such a blessing because work is really intense for me right now. And my partner also works at the hospital. So we are a 2-hospital employee family, and time is not a luxury we have right now. So I think, helping each other out with those concrete tasks can really be helpful, especially if you have friends and family that are essential workers. But then I think the other thing is just having a story that makes sense to you. So here's the story that I'm going to give everybody. What we're going through as a society is a mass trauma. Different states are at a different stage of acceptance around this, right? In New York City, we've gotten hit the hardest. But based on what I've been reading, it's going to get everywhere, right? COVID-19 is going to be everywhere. And so, there's a story we tell ourselves, which is, okay, I am not able to go to work the way I used to. My child is not able to go to school the way they used to. I'm feeling stir crazy, right? And what you need to tell yourself is this is not going to last forever. We will get through this by staying connected with each other. And when I'm struggling with anxiety, reach out for help. I do not have to go through this alone. So the other morning I woke up and I was just full of anxiety in my body. And, I started texting a few friends and just saying, I woke up feeling really anxious. Do you have 5 minutes to talk? And one of them did, and we were able to talk for 5-10 minutes, and I kind of got it out and I felt better. So I think right now is not the time to be a tough guy, or it's not the time to pretend like you have it all together. As an adult, if you need help, reach out to your network and ask for help. Because let me tell you something, we're all going through it. We're all going through it. Yes, I work in a hospital and it's really intense, but I know that there's people out there who have a family member they're caring for who has COVID-19, people who are out of work because their job shut down, people who are working from home and trying to support their kids' remote learning without going crazy, right? Because we were not trained to be teachers. So there's just, right?
We got an extra job whether we wanted it or not. Yeah.
Right. Everybody is stressed. Everybody. All feelings are valid right now. So that's my advice.
Sulaih, I wanted to make sure you got a final question in for Dr. German.
Well, I don't know if you guys saw a headline today where I guess China was in lockdown for about 76, 78 days. Do you think that it would be prudent for us to follow that same, thought that, this is what what day is this for us? 23, 24, 25? I don't even know.
For me, it's 28. For me, it's
a
28.
Well, yeah. I'm really hopeful that we're closer to, 70 something.
Keep dreaming
and that we are closer of being at the end. Is that bad?
No, it's not bad. I mean, I can share some positive news with you that in New York City, we're seeing a flattening of the curve, right? We have enough data points now to suggest that all of the shelter in place are starting to work. It's starting to slow down the rate of ill people coming to the hospital. So it's working, and that's what I want to tell everybody. Like, you're doing a service. Like, think of this as a job. You are showing up. You are doing your part. I want to say, Sulaih and to Rafa and to all of you watching, thank you for staying home. Thank you. Because those of us that work in a hospital, we need you to stay home. We're doing our part by continuing to go to work. And it's hard. We're scared we're going to get sick. We're scared we're going to bring it home to our families. Many of us have already become sick. We've lost beloved employees at Montefiore already.
Wow.
You know, there is no doubt that the price of this pandemic will be high. But the price for hospital workers, for healthcare workers, is going to be higher. And so thank you to those of you that are sheltering in place, because you are helping us by doing that. And I hope that brings you comfort when the walls are closing in on you and, you know, you just feel so worried and anxious. I want you to remember me saying, thank you. You are helping us. You are doing an act of service and gratitude. And I hope that brings you peace and comfort on those nights that you have trouble sleeping.
Dr. German from the Montefiore Center in the Bronx. First of all, thank you so much for your
so
leadership.
much,
You know, Doctor, on a personal level, I hold you, of the highest regard. And you continue to do so much for our community and our social network. We will be posting not only the English, but the Spanish language version of that video that Dr. German referenced. I know you've been very concerned about making, rightfully so, about getting Spanish language, accurate Spanish language information out to the community. And I know that's something that Janet Diaz was sort of hinting at, that's part of this dynamic. So we're going to be promoting that in social media for the next several days. Dr. German, thank you so much. And let's get you back on the show. It's overdue, and it was an honor to have you on the show.
All right, everybody, stay safe and wash your